So to position a resident from supine, which is lying on their back, to side lying, we need 4 pillows. So one that's underneath their head, and then 2 other support pillows and a smaller one to go under their arm. So I'm going to knock on the door and wash my hands. Hi Lee, I'm Myra. I'm here to move you from your back over to your right side. Is that okay? All right, I'm going to provide for privacy here. He's going on to his right side. So I'm going to raise the side rail on that side of the bed. Okay, I'm going to raise the bed up to my working height. I shouldn't be in contact with any bodily fluids, so I don't need to wear gloves for this. Okay. So Lee, first I'm going to have you scoot over towards me. I'm going to use the lift sheet. So on 3, you can move towards me. 1, 2, 3. Okay. I'm going to make sure he doesn't roll over onto his downside arm. So I'm going to move that away from his body. And then I'm going to lift this knee, which will just help them roll a little bit better. I'm going to keep my pillows close here. Okay, and I moved him over towards me so that when he rolls, he still stays in the middle of the bed. Okay, we're going to have you roll towards its side rail on your right side on 3. 1, 2, 3. Okay, are you doing okay? Okay, we'll have you grab that side rail if you can. And then the first pillow, we'll put this one in front. The bigger pillow will go behind his back. And we want to make sure that gets down right behind him so he can't roll back onto his back again. Okay, and we want to think about where there's going to be pressure. So anywhere there's a joint on top of a joint, so like his knees and his ankles, we need to make sure that that's cushioned as well. Lee, I'm going to pick up your top leg and put a pillow in there, okay? Okay, are you feeling okay so far? So I'm going to go to the end of the bed and look where he is, and he's a little bit close to that side of the bed. So I'm going to use the lift sheet and have him scoot back a little bit. Lee, I'm going to move you back towards me so you stay in the middle of the bed on 3. 1, 2, 3. Okay. Everything still feel okay? All right. Now I don't need to raise the side rail on this side because we have the pillow behind him. So he shouldn't roll back. And then I'm going to place this last pillow between his elbow and his rib so there's no bone-on-bone contact there. And make sure that that's comfortable. Okay. Does everything feel okay? I'm going to check your pillow for your head here. That looks okay. And then I'm going to take one last look from the bottom of the bed. Make sure that his body is in straight alignment and that he's still in the middle of the bed. And then I'm going to put the side rail down. And let's lower your bed back down. Okay, make sure that's locked. We'll get you covered up again. Okay. Then I need to make sure that he can reach his call light. And so I want to bring this behind the bed or underneath, just so it's not over his neck. So he's got that there. And then we'll open the door, or open the curtain. Okay. And wash my hands. Repositioning people every 2 hours is the standard of care. So if you're doing that every 2 hours, it doesn't need to be documented. If somebody does have skin concerns and they have hourly repositioning, then you need to write down the time that you repositioned them and what position you went to. So in this instance, I would say at 1300, I moved Lee from supine to right side lying.